you can see, for example, the legacy of that in the modern elementary, in the modern pre-university school systems, because the school systems that most of you attended with their rows of desks and their buzzers and their bells and their recesses are basically factory structures that emerged from the Industrial Revolution that were characteristic of the way that working people who worked in factories organized their lives. So the bells that go off between periods and to announce that it's noon and to tell you that school's out, those are factory bells. And so you can see echoes of Freud's idea that the superego and the ego and the id are in conflict by imagining, for example, how difficult it is for a very active 6-year-old, especially if they're male, to sit quietly and regulate themselves by the bell for 6 or 7 hours, when they first go to grade 1. And the fact that, Freud would say, if he was alive, that the reason that so many people have attention deficit disorder is because the demands of the superego, so to speak, in the school system are so excessive that the clash produces pathology. Now, the pathology is obviously defined by the situation. If you define pathology as being unable to sit down and pay attention to things that are deadly boring while you should be running around playing and having fun and wearing yourself to a frazzle, then that's pathology, that's attention deficit disorder. And you can treat it with Ritalin, but that's only because you can treat anybody with Ritalin, as I'm sure many of you know. So, Ritalin is an amphetamine, and it makes you focus more on whatever you happen to be focused on, though there's no real evidence that it provides any boost in academic achievement over any reasonable amount of time. But if you think about it that way, you see, you can understand what Freud meant by this superego versus ego conflict, or the superego-ego-id conflict. Attention deficit disorder is a perfect example of that. And then the pathology is defined by the circumstance. If we didn't have schools that are like the schools we have, we wouldn't have attention deficit disorder as a pathology. Now, and people like to think about it as a scientific category. It's a disease, and a disease is like an objective entity. It's like, well, no, it's not a disease, and it's not an objective entity. It's a socio-cultural construction.